My name is Eamonn Quigley, and it gives me a great pleasure today to talk to you about gut microbiota and digestive symptoms. There are three main factors that we need to consider. Firstly, the food that we eat. Secondly, our gut microbiome. And thirdly, how we, as the host, if you like, responds to it. And the interaction between these three factors is what leads to the generation of symptoms. And here we look at an abnormal microbiota or bacterial overgrowth, interactions with dietary carbohydrate leading to increased fermentation, gas-related symptoms, and disturbances in physiology. And when we talk about microbiota and upper GI symptoms, we really are focusing on disturbed physiology. This is a very elegant summary of how the microbiota might be involved in irritable bowel syndrome. I think this is pretty convincing data to suggest that there is an association between bowel habit, stool form, and your microbiome. I think there's good evidence that increased gas production is associated with the development of flatus. What I've also suggested is that gas production may not be increased in relation to bloating and distension. So what are my conclusions? Firstly, I hope I've convinced you that gut microbiota host interactions are potentially relevant to many GI symptoms, including those emanating from the upper GI tract. Secondly, microbiota diet interactions are critical to the production of intestinal gases through fermentation and short-chain fatty acids. And along the way, I've illustrated some areas where short-chain fatty acids have effects that could change motility, could change secretion, and certainly could induce symptoms. I've emphasized the important role of the microbiota in bile acid metabolism, and that this can lead to alterations in stool form and frequency. And indeed, this interaction between bile acids and stool form and frequency has been actually used therapeutically to either prevent diarrhea or actually to treat constipation.